The Commonwealth of Virginia Health Benefits Program. Here's what's coming on July 1st, 2013. Remember, open enrollment is May 1st through May 24th. There are many exciting changes this year. You will have a new plan option and some new tools to help put you on the road to a healthier lifestyle. A new plan, Cova Health Aware, includes a health reimbursement arrangement, or HRA. That's a fund to help you offset some of the plan's out-of-pocket costs. More on that in a few minutes. Some of the administrators for Cova Care and Cova HDHP will change. And there are also changes in the expanded dental optional buy-up. We have more good news. Depending on your plan, you may be able to earn rewards to help you lower your monthly premiums. Plus, there's a new program to help you and your family take steps to improve your health. And finally, there's a new administrator for our flexible spending accounts. With so many changes to discuss, it's time to get started. Here are your health plan choices for the 2013-2014 plan year. First, let's talk about the new plan you can select. Cova Health Aware covers medical, pharmacy, dental, behavioral health, and EAP services, the same benefits you already know in your current plans. It is a deductible-based plan with coinsurance similar to the Cova HDHP. The in-network individual deductible is $1,500, and the family deductible limit is $3,000. Once you meet the deductible, the plan pays 80% and you pay 20% of covered in-network services. To help you pay for the deductible and other out-of-pocket costs, the Commonwealth will fund a health reimbursement arrangement, or HRA. We'll discuss how that works on our next slide. Cova Health Aware also includes preventive care, such as an annual wellness checkup, mammogram, and colonoscopy, offered at no cost to members. The plan also pays 100% for annual routine vision and hearing exams, and diagnostic and preventive dental services. All benefits are administered by Aetna. Here's a look at how the HRA works. The Commonwealth funds $600 for an employee or retiree in the HRA and $600 for an enrolled spouse. So, if you cover a spouse under your plan, you and your spouse would receive $1,200. The funds are available on July 1st to help pay for the costs the plan doesn't cover. And there's more. You or your spouse can earn additional funds in your HRA by completing certain healthy activities called do-rights. The do-rights this year are getting an annual physical exam, a dental exam, or a flu shot, and using one of the My Active Health portal trackers 3 times a month for each month and a quarter. Portal trackers include such things as blood pressure, hours of sleep, weight, and BMI, among many others. Each do-right is worth $50 for your HRA, up to a maximum of $150. If you do the math, that means a total of $750 in your HRA for an individual, or $1,500 for an individual and spouse. This is enough to pay half of your deductible. And if you have funds remaining in your HRA at the end of the plan year, you don't lose the money. It carries forward to the next plan year. Several more things about this new plan. If you'd like, there are 2 ways to customize Cova Health Aware. You can buy the expanded dental optional benefit, or you can buy expanded dental and vision to also cover frames and lenses. Both of these optional buy-ups cost you more in premiums. No matter which Cova Health Aware service you use, you will have just one customer service number to call, except for your behavioral health and EAP services. Just a few words about Aetna Navigator, the Aetna Secure member website. It gives you 24/7 access to all of your plan information. You can see on the slide some of the things available. You may also find a doctor, dentist, pharmacy, or hospital. Check on the status of a claim. Look up your benefit coverage levels. Check symptoms, research tests, and find the closest medical provider. And much more. Let's move on to Cova Care, which will continue to be a plan option this year. What's new is that the Cova Care plan just got simpler. Starting July 1st, your pharmacy, behavioral health, and employee assistance program benefits will be through Anthem, right along with your medical and optional vision and hearing benefits. Your dental coverage is still with Delta Dental. For Cova Care, the emergency room copay will increase from $125 to $150. We'll be giving you more information during the year about how best to use the emergency room and how getting care at the right place can help you save money. Here are a few things you need to know about the change in your pharmacy benefits from Medco to Anthem. Most drugs will be on the same tier, but a few will go up or down a tier. You can easily check the drug list by tier at anthem.com/Cova. Certain drugs may require prior authorization or step therapy under the Anthem benefit. Anthem will honor previous prior authorizations and step therapy requirements. If you are enrolled in Cova Care today, your mail order prescriptions with refills remaining under the Medco plan will transfer to the Anthem Express Scripts home delivery plan. Expired prescriptions, prescriptions with no refills, Class 2 controlled substances, and payment information cannot be transferred. So starting July 1st, you'll need to call the new home delivery toll-free number to provide payment information and initiate the first order. And one last piece of great news. Cova Care members will have one member services number and integrated web access to medical and pharmacy information at anthem.com. Don't forget, all of this information will be available at www.anthem.com/Cova. There's a special 24/7 toll-free Anthem number for Cova Care members to access behavioral health and EAP services. A clinical team is available to help you understand your benefits, assist in finding mental health providers, and handle authorizations for care. Behavioral health will be handled by the same team that manages your medical care and pharmacy benefit, a team of healthcare professionals dedicated only to Commonwealth of Virginia employees. For the Cova HDHP plan, there are two important differences for July 1st. First, Anthem will administer all benefits except dental services, which will be provided by Delta Dental. Second, an expanded dental buy-up is available. That's our next topic. Beginning July 1st, there will be no annual limit on what the plan will pay for your diagnostic and preventive services. These include services such as exams, cleanings, and x-rays. Remember that coverage is included with your health plan at no additional cost. The Cova Care, Cova HDHP, and Cova Health Aware plans will include an expanded dental buy-up option. The expanded dental buy-up option will include coverage for primary services, things like fillings, extractions, and root canals, at 80%, and major services such as crowns and bridges at 50%. Both primary and major services are subject to a deductible and a plan year maximum. Expanded dental also includes orthodontia coverage. So if you think you will need these services, it's important to consider purchasing the buy-up. Another plan change for July 1st, is that these plans will pay 100% for covered generic contraceptives, as required by the Affordable Care Act. Next, we'll look at the Kaiser Permanente HMO, which is offered primarily to members in Northern Virginia. Kaiser has reduced the out-of-pocket maximum for the July 1st plan year, and some copayments have increased. For example, an office visit to your primary care physician now requires a $25 copayment, and if you must see a specialist, that copayment has increased to $40. Kaiser has a website that is available to members 24/7. You can schedule appointments, view your medical records, and send emails directly to your doctor, and much more. Cova Connect will no longer be offered. You have several alternatives. You can enroll in another health plan such as Cova Care or Cova Health Aware. You can waive coverage, or you can take no action and default to the Cova Care plan with your current optional buy-up. Like Cova Connect, Cova Care is a PPO plan and has similar benefits. We will continue to offer the TRICARE supplement to participants who are military retirees and their families. You must be eligible for TRICARE and the state program to qualify for coverage under the supplement. You pay the full premium amount, and your premiums are deducted on a pre-tax basis. Here's an extra this year for those enrolled in either Cova Care or Cova Health Aware on July 1st. Premium rewards. Here's what you need to do to earn premium savings. Complete a health assessment during open enrollment for a premium reward of $17 a month for an individual and $17 for a spouse. You will receive premium savings between July and December of this year. Take a biometric or health screening between August and October to continue your premium reward from January through June 2014. The screenings will be available at work sites, at certain LabCorp locations, and at your doctor's office. Through earning premium rewards, you or your enrolled spouse will save a total of $204 for the year. If both of you qualify, your total savings will be $408. This chart shows how premium rewards will impact your monthly premium. For example, let's say that you and your spouse both earn premium rewards for the entire plan year, or a savings of $34 each month. If you enroll in Cova Care with Employee Plus One membership, your monthly premium is $130 rather than $164. On an annual basis, you save $408. If you and your spouse elect the Cova Health Aware plan, the monthly premium would drop from $78 to $44, with the same annual savings of $408. Let's move on to a new tool that all participants eligible for health care will have beginning at open enrollment. Active Health Management will administer My Active Health, our new program designed to help members be and stay healthy. It's a holistic approach that goes beyond wellness. The My Active Health portal includes a health assessment, the ability to create a personal health record, plus resources to help you live a healthier lifestyle. On July 1st, it also will house the Healthy Insights program to help you better manage chronic conditions, the Healthy Beginnings Maternity Management program, and the Healthy Lifestyles Coaching program. My Active Health also will oversee the premium reward, diabetes management, and bariatric surgery pre-education initiatives. To register on the My Active Health portal, complete the fields required, which include your 9-digit state employee ID number, and use your name as it appears on your insurance card. Once you complete the registration information, you will create a username and password that is specific to you. If you later forget your username and password, you can call the 800 number listed on the portal site for help or select Retrieve Username or Forgot Password on the login page. We mentioned the health assessment earlier. A health assessment is a confidential questionnaire about your health and lifestyle, like your age, height and weight, your diet and exercise habits, and whether you smoke. It's available through My Active Health beginning May 1st. You may take this confidential assessment even if you are not enrolled in a state health plan. If you use the portal, you will get a personal health report right away. Those who take the health assessment by telephone will be mailed their report. And as we said before, participants and spouses enrolled in Cova Care and Cova Health Aware who complete the health assessment during open enrollment are eligible for a premium reward. My Active Health will offer biometric screenings beginning in August. This testing is voluntary, but you can gain valuable insight into your health. The biometric screenings may be available at your worksite location, at designated LabCorp facilities, or at your doctor's office. There is no cost to you. Individual results are confidential and will not be shared with the Commonwealth. As we said earlier, Cova Care and Cova Health Aware participants have to take this screening to continue their premium rewards. Beginning in July, there are many additional tools available to you. So what's new for flexible spending accounts? There are a couple of changes for July. Anthem is the new claims administrator. Remember that all employees eligible for health care may enroll in FSAs, and you must re-enroll each year. Another change is a new limit on the amount you can contribute to a health FSA. Your contribution may not exceed $2,500 to comply with the Affordable Care Act. Be sure to use all of your FSA funds during the plan year, or you will lose the money. If you elect the new Cova Health Aware plan, you may have both the plan's HRA and an FSA. Just remember that your HRA dollars will be used first to pay for your expenses before your FSA dollars can be used. So plan carefully. To make it more convenient for you, the Anthem FSA features a benefit card you can use instead of paying out of your pocket and being reimbursed later. Remember, all payment card transactions will need validation. If you choose not to use the card, you may complete a claim form, attach the receipts or other supporting documentation, and submit via fax, mail, or online. Anthem FSA will mail a reimbursement check to your home or issue a direct deposit to your personal account. Starting July 1st, you'll have access to an online account to view your balance, contributions, claims, benefit card activity, and much more. There's another tool that you may find helpful. Get to know Alex. In a year of so much change, we wanted to give you an interactive assistant to help you decide which plan is the best fit for you and your family. So you can go online and ask Alex. As you review, please remember these important points. Alex is built using only the basic plans from Cova Care, Cova Health Aware, and Cova HDHP. The tool does not include buy-up options such as expanded dental and out-of-network. It's designed only for active employees to use, and the examples are based on 12-month employees. FSA deductions are displayed as dollars and cents, but will always round to whole dollars. When you log in, Alex will ask you questions about your individual healthcare needs, explain the plan offerings, estimate the lowest cost plan option, and provide a plan comparison. The final decision rests with you. We've talked about many things today: plan changes, new tools, and FSAs. Here are some tips as you consider your options this year. Do some research on the plan's websites. Plan customer service representatives will also be available to answer your questions. This year's choices mean you need to do some digging. Be sure that your doctors are in the provider network for your plan choice. Check the benefits coverage for your prescription drugs. And give Alex a try. Doing these things will help you make the right decision for yourself and your family. For more details, visit Employee Direct online. Also see the open enrollment link on the DHRM website. Contact your agency benefits administrator and the plans. See the Spotlight newsletter, mailings, and emails about specific programs. Once you've completed your research, these are your options during open enrollment. You can enroll in a plan, change plans, waive your coverage, and add or remove eligible dependents. If you are now in Cova Connect, remember that if you take no action, you will default to Cova Care. This is also the time of year to enroll in a flexible spending account. If you have an FSA, it will end on June 30th unless you re-enroll. All changes will take effect on July 1st. You may make changes between May 1st and May 24th when open enrollment ends. You must complete all open enrollment actions by that date. Submit an enrollment form or use Employee Direct. Even though Employee Direct is available until 11:59 p.m., don't wait. Be sure to give your final answer on May 24th.